Hi, welcome to Health University and the optimal pregnancy prep for natural conception or IVF. I am your guide, Dr. Susan Fox, and here at Health University, our goal is to really help you find your best prep for pregnancy, whether it be natural conception or IVF. And the starting point is always to make sure that your body is in as healthy and optimized a condition as possible before getting that positive pregnancy test. So let's go into a little bit about why and what I recommend and why. So I'm Dr. Susan Fox. I am founder of Health University. I'm a doctor of acupuncture and Chinese medicine, board certified fertility specialist, and fellow of the Acupuncture and TCM Board of Reproductive Medicine. We call it aborm.org. I'm also a member of the Pacific Coast Reproductive Society, the American Society of Reproductive Medicine, and the Resolve Fertility Support Network. For more than 20 years in private practice, I've helped women and couples realize their dream of family, whether through natural conception or in supporting their IVF journey or other advanced reproductive therapies such as IUI. And in 2021, I created the Your Fertile Health program at Health University, which is an online education program that incorporates research-backed strategies and protocols on how to improve whole health and reproductive health. Don't believe me? You can check out testimonials at the healthuniversity.co/testimonials page. And the reason I am wanting to talk about the importance of preparing for IVF is that it is not just about the positive pregnancy test. It is about the investment that you're making for your health, for your baby's health, for your family's health, for your community's health, for the health of the future. If you're doing IVF, it's important to know that the success rates for live birth via IVF, as reported in 2018, a 38-year-old would have a success rate of about 27%. A 41, 42-year-old would have a success rate of about 14%. And a 43-year-old would have a success rate of about 4%. So as you can see, those success rates go down. Many would say it's simply due to age and the decline in follicles and the quality of the eggs therein. I'm going to suggest that that is not the only case in point, but also it has to do with the health of these ovaries and follicles and the eggs growing within. The cost of an IVF retrieval cycle is significant. It's an investment. Each retrieval is about between $15,000 and $30,000, depending upon the various modalities you might undertake. Are you going to do genetic testing? Are you going to freeze? And in that case, it can cost about $30,000. Oftentimes, there are about 3 egg retrievals required in order to bring forth enough embryos to assure, obviously there's no guarantee, the likelihood of a positive pregnancy or a healthy pregnancy. So that's about $90,000. And so once again, why prepare? As I say, the math adds up. Add up the math. You just getting yourself ready with healthier eggs, healthier embryos, a healthier uterus in mama's body, so that you're not just having a positive pregnancy test, that you're having a healthy pregnancy, a healthy postpartum, and a healthy family. And what does it look like to prep for pregnancy? The first thing is detoxification. Regrettably, but it is fact, we live in a very toxic world. And under the best of circumstances, we are going to be infiltrated with many toxins. So reducing that toxic load to the best of our ability will have beneficial impacts on us for years to come, and certainly through our pregnancy. We also want to be considerate of our nutrition, which kind of goes hand in hand with detoxification, because our bodies want to detoxify themselves, and they can be helped to do so when they're given proper nutrition, whole foods, high quality, pesticide-free, organic, wild caught, free range, grass-fed, grass-finished, so on and so forth. It matters. We want to make sure we have targeted circulation to the ovaries and uterus. Our lifestyle these days has us sitting a lot in front of a Zoom camera or otherwise kind of repeating the same physical movements over and over again, even at the gym, so forth, for instance. But what we really want to do is make sure we have circulation to our pelvic floor, to our ovaries and uterus, so that those organs can be as healthy as they can be to respond to the hormonal signaling that is being asked of them. And then finally, well, not finally, but in addition, sleep. Sleep is our missing prescription. We are living again in a lifestyle that is not in accordance with nature. We are not waking with the light and going to sleep when the dusk falls or when dark approaches. Instead, we have our blue lights running all the time, which means we are running as though it's high noon all the time, which means our cortisol is perpetually higher than it needs to be. And that causes a problem down the road, and I'll explain further. Wanted to give an example of how prepping for pregnancy using the Your Fertile Health program and method works. We had a patient who had an unsuccessful IVF. And when she came to us, she was very, very sad, very despondent. And we worked for a few months using the protocols. She tried again and she got pregnant with her son. Fast forward 2 years later, she wanted to add to her family, went back to IVF, tried again on her own without the program, and did not have success. Came back and implemented the program, did another transfer, and lo and behold, then became pregnant with her now beautiful daughter. So what happens in an IVF cycle? I think it's important to know why we are paying so much attention to this, because we do have a timeline within which we can do all that we can do to help support your health and your baby's health. Excuse me. So first we do labs and diagnostics. So the IVF center will do labs testing your fertility hormones, your FSH, your LH possibly, your estradiol, your progesterone, and then they'll test some other things like whether or not you've got adequate signaling for thyroid hormone, because we want to make sure your thyroid hormone is not going to rise and fall too drastically, because that is a setup for a miscarriage. There can also be other labs that we would recommend. And so working with our program, we do have a list of labs that we recommend to just ensure that mama's body is as healthy as it can be, because again, it's not just about the getting pregnant, it's about having a healthy pregnancy and being set up for a healthy pregnancy and a healthy postpartum. During the IVF cycle, some of these diagnostic tests may determine that you need treatments. If you have, for instance, fibroids or endometriosis, or if there is scarring that they find or a septum that they find in your uterus, or if you've got perhaps polycystic ovarian syndrome, they want to make sure that they're not hyperstimulating your ovaries during a stim cycle. And here again, this is where we can come in and use diet, lifestyle, circulation techniques, and supplementation that will help improve whatever the diagnosis is. And once I would like to just comment that the diagnosis is an explanation of what's going on in your body at this time. It isn't always a life sentence. And this is where we can really help by making a change to the circumstances that created this diagnosis, improving the environment, improving the epigenetics. So then in the IVF cycle, you'll start to receive some stimulation medications to grow more eggs that might otherwise be grown, triggered, stimulated in a natural cycle, because the doctor is wanting to retrieve as many of those eggs as possible to make as many embryos as possible. But here again, my note is that doctor can only stimulate and retrieve the eggs in the quality that they are right now. But we can improve our whole health and our fertile health. And some might argue that that's not so, that there's not evidence-based research to back that up. And it's true, there's not evidence-based research to back that up, but it really stands to reason. If we can improve, for instance, our metabolic health, if we can improve our cardiac health, if we can improve our insulin sensitivity by making lifestyle changes and dietary changes and supplement changes, then it stands to reason that we can improve also our ovarian health. This is not to reverse the clock back to prior to your chronological age, although sometimes it has been shown to do that. But we want to at least reverse it back to your chronological age so that you are getting the best quality eggs retrieved at time of retrieval, which is after the stem cycle, they will retrieve the eggs. And then they'll take those eggs and put them in vitro fertilization, oftentimes with what's called ICSI, intracytoplasmic sperm injection, where they'll take that sperm and inject it right into the egg to make sure that they're creating embryos, not leaving it to chance. Then if the client patient chooses, there can be genetic testing of the embryos. Oftentimes that is recommended when people are older to make sure that there isn't a genetic misinformation in the embryo, because you don't want to transfer an embryo that is genetically not viable. Then there will be embryo freezing so that you can have the insurance for the family of your dreams when it comes time to grow your family. Usually one embryo is transferred at a time anymore. Back in the day, they used to do fresh transfers and they used to do multiple embryos in the hopes that one will stick. Thankfully, science has come so far, and now they can really feel confident in transferring one embryo, which is ideally how we are supposed to, or we're designed to gestate one baby at a time. Obviously, we can do multiples. It's been happening throughout our time on the planet, but it is not common, right? So we want to do what is going to be healthiest for the baby and healthiest for the mom. So let's turn into some solutions, what we can do. We can lower inflammation. As I say, we live in a toxic world. There's just kind of no arguing with that. The result of this toxicity is inflammation. And inflammatory markers can be found even in the follicular fluid, which means that those eggs are growing in an environment that is not healthy. Therefore, by lowering inflammation, you can improve the quality of the follicular fluid so that that egg is growing in a higher quality environment, improving its own mitochondrial function. We can lower stress hormone, cortisol. As I say, our lifestyle has us being a little bit high cortisol running chronically, and that interferes with our hormonal signaling. We are designed to either fight or flee when cortisol is high, and that would cause our blood flow, our circulation, to go to our large muscles that can fight or flee. And they're not going to go to our organs of reproduction or elimination or detoxification. So lowering cortisol is actually a key to improving our whole health and our fertile health. Circulation. I mentioned this before, and I can't speak to it strongly enough. Targeted circulation. We are using in the Your Fertile Health program protocols that were designed to assure adequate, ideal, optimal circulation to the ovaries and uterus so that they are getting their best health, so that they're responding best to the stimulation that is being asked of them. And then the impact of nutrition, right? Even recently, we've seen a couple of articles that have shown that simply improving one's nutrition can improve the effects of what is diagnosed as diminished ovarian reserve. So that, once again, that says to me, we can improve the quality of our eggs within our follicles, within our ovaries, by improving our whole health. A little comment here that one of our clients was resorting to IVF, thinking that that was going to be her answer because she had had several miscarriages. And when she had her embryo transfer, that she miscarried as well with IVF. Coming to our program and implementing our protocols, she was able to do another embryo transfer, and her daughter was actually born recently, very healthy, and a successful transfer, a successful pregnancy, and here again, a happy, healthy family. So, when to begin detoxing for your best prep for IVF or natural conception? The answer is now. Ideally, we would have 6 months to make sure that all tissues were in their optimal health. We don't often get that kind of time frame, so we would say possibly minimally would be 120 days, 12 weeks. And the reason being is that we want to make sure that we have enough time to influence the growth of those follicles from the time they are in what is called the primordial pool, which is to say, we don't know where they're coming from. We just know that there's a potential for an egg to be released, right up until the antral follicle phase, where we know that they are going to be released with that month's ovulation or with that retrieval. So I would say, let's try to do at least 3 months, it's 12 weeks. But if you can't, once again, we are designed to detox, we are designed to improve our health. There isn't a too late, there isn't an it's too late time to begin doing our detoxification until a positive pregnancy test. I just want to put that caveat in there. We do not detoxify when we're pregnant, which is why it's so important to detoxify before we get that positive pregnancy test. For men as well, it's important that they detoxify, that the gents detoxify as well, because their sperm health is also contributing to the DNA of this embryo. And if that DNA is in poor shape, then it's going to not be a healthy embryo. The spermatogenesis timeframe is about 75 days, so 2.5 months. So once again, do this together, do this with your partner, or if you are wanting to make sure that you just have the healthiest embryos possible, do make sure that the donor has a healthy sperm. Okay, what is toxic load? How do you know if you've got a toxic load? Well, I think that most of us have a toxic load, and some of the symptoms that you might look to say, do I have a toxic load, would include digestive complaints. Are you having diarrhea, constipation, bloating, belching, acid reflux? Are you having headaches or brain fog? Is your sleep interrupted? Are you waking frequently with difficulty falling back to sleep? Or are you having difficulty falling asleep? Do you have mood changes either around the time of ovulation or just prior to menstruation? We refer to that as premenstrual syndrome, PMS, or premenstrual dysphoria disorder, PMDD, which is really more of the mood changes, whereas PMS can sometimes have the physical changes as well, such as breast tenderness, bloating, etc. As I said before, you can't do your detoxification during pregnant because there's a baby growing inside of you and there is an umbilical cord that is receiving your blood. So you do not want to be dumping toxins into your blood, because the umbilical cord blood shows about 4 times the toxic load of the maternal blood. So when you think about this, you're having a baby growing inside of you that doesn't even have all of its barriers up. It's neurologically just developing. It's physically just developing. And if it's swimming in a toxic load, then it's at a disadvantage. So let's do the cleanup beforehand, shall we? And then some people will say, well, should I test? And the answer is possibly yes. It doesn't hurt to test, but I would say that it's important to get started anyway. At the end of this presentation, there will be some resources, including a test that you can do at home that would show the environmental toxic load. And I recommend it. And I also would say it is as good as the second test after you've done your detoxification. Okay. We talked about the importance of being as low a toxic load as possible during pregnancy or in preparation. So what are these toxins? Well, we've got pesticides on our foods. We've got fungicides on our foods. We've got toxic gases that are off-gassing our clothing, our carpet, our furnishings. And as I mentioned before, they can be as high in umbilical cord blood as 4 times that of mother's blood. A little comment here about a friend. She's become a friend who had her eggs frozen and was getting her body ready for IVF. when she learned that she had been exposed to toxic mold in her home. So we put the brakes on getting ready for transfer and really went deeper into the detoxification. And within a couple of months, she got pregnant naturally. And her healthy baby boy is really set up for a strong immune system thanks to all of her efforts. Detoxing with nutrition. So we are recommending here at Health University a 28-day detox program. We know it can be burdensome, so we're trying to make it as minimal as possible and as normal as possible. We're not asking you to go on any special diet. We do want to remove some of the known triggers, such as sugar and alcohol, and for some people, caffeine, not all, but at least minimizing caffeine. And then we're talking about the importance of, again, pesticide-free organic. If you can't go organic, and I challenge that a little bit because now, all of the big box stores even have organic frozen vegetables. And frankly, sometimes the frozen vegetables are fresher than the fresh vegetables because they are picked and frozen immediately. And so you are having all the benefits of an organic fresh vegetable that has just been quickly frozen. If you find you can't, then just at least be aware of the clean 15 and the dirty dozen. The clean 15 are the safest fresh vegetables that you can have if they're conventionally grown. The dirty dozen are the most dangerous of those that you would eat, that would be highest in absorbing the pesticides if you were to take those. Our program is designed to be gentle but dynamic. So we begin slow in the first 7 days so that you're not feeling the ill effects of detoxification. And then we ramp it up in the next 14 days to really help with this detoxification and methylation to help clear the liver and the large intestine of the toxic buildup. And then we drop it down again in the fourth week, the final week, so that you can reintroduce your everyday lifestyle activities in dietary guidelines, if you will, without feeling like there's too much stop and start. Our goal is to have this shift the way you think about nutrition so that you are enjoying healthier whole foods that are as close to the original source as possible and continuing to remove processed foods and, again, the known culprits like sugar and gluten. Oh, I had mentioned this already. Pesticide free, so very important. So I'll just say it again. And then hydrating. And so this is water. This is not liquids. I do have people sometimes saying, well, I drink tea a lot, and that's fine, but tea is not water. So try to use purified, filtered water because unfortunately our tap water is known to have contaminants, including hormone disruptors, and other kind of chemicals that are not conducive to our health or our baby's health. We want to also not drink from plastic bottles. When you think about it, that water is being poured into plastic that is very flimsy. Then it's getting shipped, and all of the estrogen disrupting hormones that are leaching from that bottle are leaching in a high concentrate in the water you're about to consume. So really try for glass or an other well, glass is ideal. So if you can go with glass, and it's the way to go. And then take in as much as your body weight in pounds, your ideal body weight in pounds, in fluid ounces. So if your ideal body weight in pounds was 130 pounds, you would want 130 fluid ounces. If that calculation makes your head spin, just go for 3 liters. I suggest that fill up 3 liters each morning in three glass containers, or 1, knowing that you're going to do it times 3, and then have that be your visual cue. Maybe have 1 done by noon or 1 done by 2 or 3, 1 done by 6 or 7. You kind of do want to be finished up by around 7 o'clock so that you can void in time to be really assured that it's not going to interrupt your sleeping by having to get up and urinate. You want to make sure you've got electrolytes in that water. And so there are lots of electrolytes out there in the market, but frankly, if you want to go natural, put a squeeze of lemon and a pinch of Celtic sea salt into one of the water bottles. It doesn't have to be all three if that's not your flavor of choice. And that will give you your electrolytes back, the sodium, obviously, in the salt, and the potassium in your lemons. And then movement. We talked about targeted circulation, and I will go into that in greater detail, but let's just get moving. Let's go forward again. Let's get moving. Let's make sure that we are having proper circulation so that we can really help with the detoxification. Our muscles help move our lymph through our body, and we will sweat out some toxins, and it will also help with our elimination. So really try to keep yourself moving. There are different types of movement that are appropriate at different times in your menstrual cycle when you're trying to conceive or undergoing IVF. During week 1, when you're menstruating, I suggest avoiding inversions or quick twisting, torquing. We want the menstrual blood to be able to just flow out through the vagina as it's supposed to. Week 2, when follicles are growing, you can really enjoy a little bit more rigorous activity of your choice. And then at week 3, when you're about ready to ovulate, those ovaries are pretty full. And so we want to make sure that you're not doing too much twisting and torquing as well. We want your body in its anatomical straight position. Now, that being said, you can do turning movements, but if you're doing a yoga pose that has you turn to the side, turn your torso first and then go into your Trikonasana pose so that you're able to keep that body, that pelvis in an anatomical plane. And in week 4, in a month where you're trying to conceive, avoid downward bearing activities such as deadlifts or squats and leg presses, because we don't want too much pressure pushing back up into the uterus, because we don't want that menstrual blood to be pushed out through the fallopian tubes and into the pelvic cavity. That is a setup for endometriosis. Sleep, 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 sleep. The new prescription, as I say. Establish some healthy sleep hygiene habits, please, because how you wake is going to affect how you fall asleep, and how you fall asleep will affect how you wake. So, like we do with babies, set up a regular sleep schedule. Try for 8 hours a night. I think the ideal is for most people 11 p.m. to 7 a.m., which is to say get in bed before 11 p.m., which is to say get your electronics off at least by 10:30 p.m. or 10 o'clock, 30 minutes before you expect to get your head hit the pillow. And the reason being is that the electronic lights, the blue lights, once again, will have your brain through the retina of your eyes think that it's high noon, and it won't produce its own melatonin, your own super antioxidant and sleep hormone. And let's go into the next slide. We're going to be concerned about clean skincare, because what we put on our skin is as important as what we put in our body. And a lot of our skincare products have formaldehyde, mercury, phthalates, parabens, forever chemicals, all of which have been known to cause cancer, damage our reproductive organs. And so we want to make sure, went back to circadian rhythm. Let's go back again. We want to make sure that we're taking care of our skin as well as our mouth. We have an oral microbiome. It is tied to our whole microbiome, our digestive system, and it's tied to our vaginal microbiome. And when you think about it, there's the barrier between our mouth and our bloodstream is very thin. So we don't want the harmful chemicals and harsh abrasives of over-the-counter toothpastes and mouthwashes and so forth. They can contain things like a pesticide, triclosan, sodium lauryl sulfate, which is what causes it to be foamy, and then artificial sweeteners, which the very word artificial should be a key that it is not good for us. So switch it out. We will have some resources in at the end of this presentation. And then home care. Oh, goodness. If we could see what was on the label of some of our home care cleaning products, we would probably cringe. And at a minimum, even if we can't see what's in our laundry and our home care cleaning products, we can smell it. We can smell it. And sometimes if we can't smell it, we're smelling a lovely fragrance. It's a synthetic fragrance. So we're putting again, synthetics into our bloodstream through our nasal passages or through our skin if we're touching areas that have been cleaned with harsh chemicals called volatile organic compounds. They can evaporate in the air and into our lungs, and then use some plants. The plants will help absorb those VOCs, and then they also just add a little bit of beauty to your home. So some takeaways. Detox, super important. Step one to preparing for your IVF. Whether you are, and I say IVF, but whether you're trying to conceive naturally or going through advanced reproductive therapies. The other takeaway is that I don't want this to seem burdensome or overwhelming. Any small change is a significant change. And it's compounded when you add a few changes together. And starting now will help you within 30 days or ideally 120 days to really change your whole health and your fertile health. We use the 28-day detox as a starter, and there will be resources to how you can access this at the end of this presentation. I've curated a lovely, simple protocol that is simply a scoop a day for the first 7 days, a scoop 2 times a day from days 8 to 21, and a scoop a day from days 22 to 28. And then there are pre-curated packages of amino acids and B vitamins and other supplements that really help with this detoxification. So very simple, easy to do. Use your own diet. Just take out the culprits, eat healthfully, because we want this to become part of your lifestyle. And get a head start. Right now, go ditch the soda, the alcohol, the sugar, the processed junk foods that are in your pantry. Check your canned goods to make sure that they are BPA free. Replace all your plastic storage containers with glass. Replace Teflon and aluminum cookware with cast iron, enameled cast iron, stainless steel, or glass. And if you need a non-stick pan, make sure that it is Teflon free. Stock up on organic, fresh, and frozen produce, and choose organic, wild-caught, grass-fed and finished, and free-range proteins. Replace your cleaning products with products you can even do yourself. For instance, you can use white vinegar, baking soda, distilled water, and a small amount of phosphorus-free dish soap to make your cleaning agent for your countertops, etc. If you want a fragrance, use pure essential oils to give you that scent. Implement some fun, stress-reducing activities into your everyday life to get that circulation going, and then improve your circadian flow is the term we use for proper wake-sleep cycles. Wake with the sun, minimize your blue light, and turn off your electronics 1 hour ideally, but at least 30 minutes before bed. So thank you so much for your time and attention today. I really appreciate you doing so. It has been a lovely sharing this with you. There'll be a set of resources in the next slide, and I'll leave that up for a little bit so you can take a photo and access what you need. And always feel free to reach out to me. We are at conceive@healthuniversity.co, not .com, conceive@healthuniversity.co. And if you wanted to take Your Fertility Quiz, that is yourfertilityquiz.com, and it will let you know what is your 5-element type, fertility type, to let you know what might be going a little sideways for you when you're not in your optimum health, and how you can right the ship, so to speak, to get back there. So, and also we mentioned labs earlier on. So we have here, you can use the QR code, a storefront that you can go and order your labs directly. We've created sets of labs for a cycle day 2 or 3, a cycle day 21, and then a couple that are anytime in your cycle. We've set aside some labs that are also for digestive disorder, because sometimes the microbiome being out of balance is the issue at hand. And we want to make sure that your gut flora is healthy to support your healthy pregnancy. More resources here. The store.healthuniversity.co is where you'll be able to get your detox supplement bundle. We also have some skin supplies there. I've put all the skin cleaning and conditioning offerings, products from Anna Marie Skincare, 100% toxin-free, organic, you won't need or want all of them. Choose what you want, and you'll be assured to have really beautiful, radiant skin that is healthy. There are some home air purifiers, if that is something that you feel that you need in your home. And then we have Orasana oral care products. They are designed to help support a healthy oral microbiome and healthy cleaning of your teeth. So there, your toothpaste, toothbrush, water flossing, and all of that. And then finally, Blue Land home cleaning products. If you don't want to DIY, Blue Land is a really great way to make sure that you're getting clean cleaning products so that you're not making your home a toxic mess while you're trying to clean it up. And we mentioned the DIY environmental toxic load test kits. Million Marker is the name of that kit. And if you use the code Your Fertile Health, you will get $10 off your Detect and Detox kit. So once again, thank you for your time. Oh, here's more. So in supplements. So I curated through a particular company that only sells to practitioners because they pride themselves in not being the wild, wild west of supplement land. They want to make sure that people are getting the supplements they need in the quality they need, in the quantity they need. And oftentimes, especially in the world of fertility, people will just, read something online or in a group and run out and get it. And it may be exactly what they don't need. So we've put together bundles for preconception care that are basic, that are PCOS oriented, that are diminished ovarian reserve oriented, that are autoimmune oriented, and each will have a slightly different set of supplements that will support you where you are. And you can find them here, Health University, pardon me, the store.healthuniversity.co, and with the code HEALTH15, you'll get 15% off the Health University product line. And finally, you can connect with us. I had mentioned conceive@healthuniversity.co is where you can send an email. You can find us on socials, and you can find us at our website at www.healthuniversity.co. So with that, I'm going to stop sharing this presentation and just come back to chatting with you while we wrap it up. Thank you for taking the time. I appreciate and I hope that you found this to be useful. It is my goal and intention to only give you what is going to be useful for you. And if this seems of interest, please do click through. We do have an opportunity to do a gentle detox protocol group. You have everything you need, so it's really not required. But some people do like to have that kind of support. And there's just a couple of guides that will help you along if that is something you'd like. And if you are planning an IVF or wanting to conceive, I can't recommend highly enough to consider the Your Fertile Health program. It is a comprehensive program that has helped so many improve their success, and I would love for it to help you as well. So thanks again for your time. Be well.